Welcome back to Medical Coding with Blue. Today's episode is all about how to gain experience as a brand new medical coder. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So I get this question quite a bit. Blue, everybody wants experience. How am I supposed to get experience if no one will hire me? Blue, they want 3 to 5 years of experience. And how do I get in if I don't have that? I've never been in the medical field before. Hopefully the tips I give you today will help you on your journey to finding your first job. Now here's the thing. I will say this before I really get into everything. You can find a job. It is possible. And the energy that you put out there is what you're going to get back. If you are immediately negative, meaning that you go into these Facebook medical coding groups and you're listening to all these people and their negative energy and they're saying, oh, I can't find a job, or no one will pay me because I'm brand new. If you're listening to all that garbage, it's going to fester into your own mind and you're going to end up putting that energy out. So stop listening to people who say that, oh, I can't find a job, I can't find a job. You can. You can. It just takes a little bit of effort and some hard work. That's all, okay? So that's the first thing out of the way. The second thing is this. You are getting into a field that the bottom line is money, okay? Medical billers, medical coders, we all talk the same language. What we produce ends up producing how much money the facility's going to make, the doctor's going to make, how much the patient's going to have to pay, okay? It all depends on the medical coder's interpretation of what the doctor has documented and that coder's ability to be able to get the correct codes, the correct sequencing, the correct procedures and modifier applications, everything. So there's a lot of moving pieces to get the correct amount that needs to be there when it's billed, okay? Because if it's not, the facility can lose money, the provider can lose money, the patient may end up having to pay out more, or sometimes they end up paying less, depending on the error, okay? So we want everything to be correct and accurate. The other problem comes into play is that there are many medical billing and coding programs out there. There are some that are as little as 52 hours. Somebody told me that, oh yes, they said they could teach me everything in 52 hours, which is an insult. And it is disgusting that there are actually programs out there that claim to be able to train people in 52 hours, less than 60 hours. It's ridiculous. It's disgusting. And I hope people don't patronize those schools because of the simple fact that no, you can't learn everything that you need to know about medical billing or medical coding in 52 hours. That's just ridiculous, okay? So I have always said that you want to look for programs that are 9 months, 12 months, or 18 months. And I say that for a reason. Because these programs, that's plenty of time for you to be able to learn as much as you need to know just to be able to get you started, okay? Because it's going to be a lifelong process. It's not just a school thing and then that's it, you're done. This is a continuous process that you're going to be learning. But here's the thing. When there's schools out there that are saying, oh yeah, we can train you in less than 6 months, I tell y'all not to do those. And a lot of people still do them because they say, well, it's all I can afford. And then you're not supplementing your learning from that program when you could be, and that could help you even more. Because the goal is to get you to be competent as possible when you're out there looking in the real world for your first job. But a lot of people want to take the shortcut. They want to fall into that trap and that fantasy of, oh yes, you're going to be able to get paid all this money because that's what the school is selling. And so because of this produces a lot of people that do not have the competence to perform this work. So now who suffers? The employer. Because now we have a whole bunch of people who are coming in saying that they're medical coders. They have their certification because the school taught them to pass. Oh yeah. They taught them how to pass a test. And now they're out there proclaiming that they are a medical coder and they are brand new with no experience. Now they're going to expect that employer to be able to train them. Well, guess what? That employer doesn't have time. If they're looking for a medical coder, they need somebody who can hit the ground running and move. Not somebody that's going to need their hand held. And there's a lot of people nowadays that want their hand held. It's not just a generational thing, guys, okay? I get people who I hear from 18 years old to into their 70s, and they all have some chorus and some story to tell, okay? So it's not just, oh, it's the young people. No, it's older people. So it's anybody that's trying to get into this field. And so some of them want to have that idea of, okay, it's going to be so easy and everything's going to be explained. And then they said they were going to train me in the school. Well, guess what? They get into the school and then now they can't figure it out because the teacher didn't want to teach them, because they were just being sold a product. So I say all of this to say that when these people get to these programs, they're still ill prepared, and then they try to get out in the real world and try to find an employer that will train them. And then the employer doesn't want to train them. That's why they keep insisting we want 3 to 5 years of experience, because we're not going to sit here and be your training wheels so that you can learn from us and then leave us. So there's a method to their madness when they're saying this thing. How do we combat this, and how do you get experience to get out there and to find your first job? I have said, and I will keep saying this, and I will keep saying this: apply anyway. You arm yourself with a very good resume. And a lot of you do not take me seriously when I talk about the resumes. The reason that I put so much emphasis on resumes is because this is the first thing that an employer will see from you. And even though you don't have experience in medical yet, you don't have any medical coding experience yet, you do have training. The training that you got, ICD-10-CM, CPT, HCPCS. If you were trained in ICD-10 PCS, put that on there as well. And each one of these needs to be its own bullet point. It does not need to be ICD-10 and then nothing. Because if I see that as a hiring manager, if I am a hiring manager, if I see that ICD-10, rejected immediately. Why? Because you weren't detailed enough. This resume is going to tell me, if I'm a hiring manager, that how detailed is this person? How competent is this person with what they're telling me that they are capable of? What are their skills? And if you tell me that you're organized, that you're a team player on your skills list, again, another reason that I would reject you immediately, because your skills is not your soft skills. I don't want to know that you have a smiling face. I don't want to know that you're a team player. I don't want to know that on your skills list. What I want to know is that you were trained, or that you understand ICD-10-CM, CPT, HCPCS, ICD-10 PCS. I also need to know that you understand medical terminology, anatomy, pathophysiology, and pharma, okay? And when you tell me about like what, whether you know Outlook, Word, Excel, or PowerPoint, I need to know these things. Those need to be the things on your skills list, okay? Those are the things that they're looking for. Because if you look at the job listings, it tells you exactly what that employer is looking for. Not only that, you need to have an objective statement. And please do not argue with me that, oh, they say I don't need to have that. Guys, if I'm a hiring manager and I'm looking at your resume and you don't tell me what you're applying for, again, immediately rejected, because I'm not going to sit here and read your mind. I am not going to sit here and go through all of the job listings that we have at our facility and try to figure out what it is that you want. So if you're not telling me specifically the job title that is at my facility that you're applying for, again, that's going to get you an immediate boot. So the people who are paying attention and who are saying, okay, you know what, I'm going to get my resume together, we're going to do this right. 1 page, no more than 2 pages. That resume history goes back no more than 10 to 15 years, and that's it. We don't need to know that you worked in the early 2000s. We do not need to know that you worked in the 90s or in the 80s. If you have any of that on there, it's an immediate rejection too, because again, you're going too far back. Nobody remembers work stuff from the 80s or from the 90s. Nobody remembers it, okay? Nobody remembers that stuff, and plus that stuff's outdated anyway. So that's the thing that I want you guys to understand. The resume plays a big part in it. Your tenacity on going out there and applying for jobs, even though they're asking for experience, again, plays a big role. Because if you're looking for those entry-level positions, Everybody else who's not paying attention to Medical Coding with Blue is also looking for those entry-level positions. And not only that, they're looking for those positions so that this person can hold my hand. Guys, you have to understand something. These employers do not want to hold your hand. They don't. They will help you if you have a question, but they need to know that you are actually making the effort to look the stuff up on your own. There's a lot of people who, I want to sneeze so bad, I'm so sorry. There's a lot of people who want to sit there and just, make it easy for me. No, you have to learn to read the books. You have to go through the manuals. You have to go through the coding guidelines. You have to do all of these things so that way you can prepare yourself. Because when you're applying for those jobs that are asking for 3 to 5 years of experience, then when they say, okay, you know what? Everybody who is experienced in this area is already working. So we're going to have to take a look at these new people. Let's see who's the most competent from their resumes. Okay, this person is listing everything that we had for our skills that they have on their resume. Let's go ahead and talk to them. And then when you stroll up in there and you're like, hello, I'm ready. I'm ready to be a medical coder. Okay, can you tell me about ICD-10-CM? Can you tell me about CPT? Can you tell me about Higgs-Picks? Can you tell me about evaluation and management? They're going to ask you a series of questions. Don't ask me which ones because every employer is different. Some will ask you about anatomy. And these are just basic questions, basic fundamental things that you should know. Everything that's pretty much in your books anyway, because those anatomy plates are there. And when you go to the interview, some people ask, should they take their coding books? I always say yes, because that shows that you're being proactive and that you're prepared. And that's what they need to see. I want to see somebody who's coming in prepared. I do not want to see somebody, well, I don't know. And this is my first job and I'm sorry, I don't have any experience. I don't care. You know what I need? I need somebody who's certified. And I need somebody who says, okay, I'm certified. This is going to be my first job. Okay, let's go. I want that person. I want that person who's going to be, okay, I'm going to figure this out. We can figure this out. And really mean it and know how to do their research, just typing things into Google. What is this? What is that? And so that way you're not having to run back and forth to the employer. So this is the other thing too. You have to show that readiness so that that employer knows that they did not make a mistake hiring you. It is possible for new people to get hired without experience. I got hired without experience. And I have said that I went through the temporary agency. I went back to the school that I got certified from, and the school's no longer there, so don't ask me. I went to the school, back to the school, and they said, okay, well, I have a friend who has their own temporary agency for medical professionals, and they're going to be able to, if you register with them, they can set you up with an assignment. And I said, well, I don't want that. I want a real job because I know everything, right? like all brand new coders, we know everything, right? So I went over there and the principal said, well, you know what? If you go on an assignment, and let's just say the assignment is for a few months, you can take whatever you learned from that job and you could put it onto your resume. And then that can help you to have some kind of traction when you're going out for the next job. And so I said, okay, at this point I have nothing to lose. So I went to the temp agency. I applied with them. I took their test, their assessment test, and they go, okay, you did great. You passed the test. We'll call you in about a week. We're going to find an assignment for you. And I'm thinking, yeah, right, whatever. And sure enough, they found me an assignment. And they said, okay, this is going to be a 3-month assignment. And, at the end, they're going to pick one person because they just need 3 people temporarily to kind of help them with the backlog. And we're going to, see, who gets picked from there. It was like a game show. It was kind of stupid. But anyway, it still got me that experience. And it was for coding cancer. So you want to be thrown into the deep end of the pool. That's exactly what I was doing. And I was coding with books. I didn't have the encoder. We didn't have electronic medical records. We were coding from paper. So I was just able to just learn from there. And with that experience, and I didn't get picked, and it was fine. But from that experience, I went on to my next assignment with the temp agency. And that assignment was supposed to last me for 5 years. But I actually was only there for 8 months because I had taken that experience that I had those 3 months. Then I took the experience that I was gaining actively with that second facility that I was at, and I put it onto my resume, and I submitted for my forever home. Now, I submitted for my forever home not once, but twice, because the first time I went through the interview process, everything was great. I was like, okay, I've got this. I'm going to get this job. I could feel it because I wanted it so bad. And I did everything on this phone interview. It was not a Zoom. It was a phone interview over the phone. And I didn't see them, but I could hear them. And it was a panel interview. And I had my books with me, and I answered their questions as confidently as I could. And sure enough, I didn't hear anything the first time. They didn't select me the first go round. And I was so upset and crying. And I remember my mom telling me that it wasn't my time yet. And then about a month later, the same position, but a better position opened up. Same place at my forever home now. And sure enough, I applied again. Because if anything, I was going to have them remember me. I knew that that was a good interview. And I was tenacious. I went after this job because this is what I wanted. I wanted to get here because this was the closest that I could get to my hometown. And I wanted to get back home to my mom so bad. And my mom was sick at the time. And so that's why I wanted to be with her. And this was the closest I could get. And when that job closed, a few days later, I got the offer after that. And so, yes. And I came here. So what did that tell you? That tells you that I had the nerve to apply, even though I did not have the 3 to 5 years experience that they were asking for. I still had the nerve to go ahead and apply anyway. And that's what you have to have. You have to have the nerve to apply for these coding positions. If you see a medical coding position, not an auditor, like you're auditing other medical coders, okay? Not a CDI position, okay? Because you don't have the experience for that. But if they're saying we're hiring for emergency department coders and, must have 3 to 5 years experience, that's fine. You are going to go ahead and you're going to submit your resume. Why? Because if you don't throw your hat into the ring, they're not going to know who you are. They're not going to be knocking on your door and saying, hey, we're looking for a medical coder and we know you're one, so come on aboard. It's not going to ever be that way, okay? It's not ever going to be that way. You have to get out there and you have to show that effort. There's a lady on LinkedIn, I won't say who she is, but I follow her journey vicariously through other people because we're not connected. But I do see her stuff pop up quite a bit. And she has her CPCA, then she got her CCS. And she had been applying with her CPCA, wasn't getting anywhere. And she got her CCS, and 2 months later, she found her first job. And she had been posting all the times that she had been applying. I think she had applied to over 100 different positions. She had been rejected 60-something different times. And she still kept going. And she still kept up her energy. And she still kept up that effort to find her first job, because it's not impossible. And she proved that it's not impossible. And she has no background in medical at all either. But she has a very tenacious spirit. She asks questions. She does her research, and it shows. And that's how you know, okay, this person does their research. We're going to go ahead and take a chance on them. And that's exactly what the company did that hired her. And now she has her first job. And you can too. So that's the thing I'm telling you guys. Have the tenacity to go after what you want. Stop listening to ignorant people. Because the other night on the show, I was in the live chat, somebody said that they were talking to another person that was in the chat. And they were saying, oh, yes, that they heard that you have to start at the bottom. You have to apply for like the front desk reception positions and that kind of thing. And I said, no, ma'am. Nope. And I explained that even though you're trying to get your foot in the door, you do not. This is something that you do not do. You do not apply for positions that are not related to coding. If you apply for a a front desk person, and you're doing reception, medical secretary, guess what happens if you do a really good job there? And oh yeah, by the way, you're a coder too. And if the employer knows this, okay, well, we'll let you do some of the coding. Well, guess what happens? They're not going to want you to leave. Why? Because they're basically getting you laboring as a coder for free when they're just paying you to be a secretary. Do not give them more than what they're paying you for. Okay? Being a secretary is not going to allow you, or a receptionist is not going to allow you to flex your skill in coding. Those types of positions, the other alternative positions that I tell you all about all the time on my channel, I have whole videos on those guys that you can apply for, is medical biller, obviously, because that will get you exposure to the codes. You can also apply for HCC, risk adjustment. Risk adjustment, I tell y'all, it's only diagnosis coding, but don't stay with it too long because it's only diagnosis coding. And there's a lot of employers out there that will not count HCC coding as experience. I've seen it in the job listings, guys. I'm not making this up because I have nothing to gain from making something like that up, okay? But what I'm telling y'all is that a lot of times when you go into those HCC positions, people stop studying and then they lose their skill on CPT coding. And you don't want to lose that, okay? So if you're going to go with HCC, just make sure that you're using it very temporarily, like 6 months, so that you can learn an electronic medical record like Epic or Cerner or, eClinicalWorks or whatever, so that you can have that onto your resume, and as well as the diagnosis coding for whatever you were doing at that time, okay? So that's what I'm saying. That one is fine. Prior authorizations is another one. It's not coding, but it will get you exposure to the notes and to the documentation and to, abstracting those procedures and diagnosis to support what the provider is trying to do for this patient. And it'll get you exposure to the insurance companies as well. Again, another great thing to add to your resume. Do not spend your time in a position that is not going to help you in some way. It needs to have some kind of connection to coding. Medical claims reviewer is another one that I haven't been really talking about because it's just something that I really kind of stumbled on a few months ago. But medical claims reviewer is working for the dark side. You're working for the insurance company, and that insurance company is going to be looking for denials. And you, as a certified medical coder, is going to know, okay, well, this should have had a modifier, or this sequencing is not right because I understand the guidelines because I've been reading them because that's what Medical Coding with Blue says. So if you do that, that's going to be helpful to you because that will build on to your resume so that you can keep going. Do not work for free. Do not do any of these, I'll volunteer. Guys, why are you volunteering in a multi-million-dollar industry? Why? These people can pay you. They are not poor. So you want to make sure that you are not giving away your skill for free. Oh, well, I just want to learn my job. No. You need to find a job that will use your skill so that you can enhance your skill, so that you can build on that skill and move on. Start applying for positions even though they're asking for experience. If they are medical coding positions, you are still qualified even though you don't have the experience yet. But if the employer sees your resume and your resume looks good because it's no more than 2 pages, okay, and it is relevant to the things that you've done and there's transferable skill there, right? Like keeping private information protected. Everybody has a job that's done that before, guys. So that's something that you can have on your resume as a transferable skill for whatever position you had. Look at what you did at that position and look and see how it can be related to anything medical, even though it may not even be medical, okay? It is possible, guys. And I just want y'all to know that. Please don't go for these free positions or volunteer positions or any of those things. Oh, I need an internship. I need an extra. No, you don't. No, you do not. Because a lot of times those internships, they're going to be for like the college students. And if not, they say, it's an internship. Sometimes it's not even about coding. It's just about like filing or something like that. Because guess what? They can't have you in there willy-nilly looking at records because that's a HIPAA violation for somebody that's not employed with them. So that's just what I'm saying. Start being brave and applying for positions that are asking for experience. Because if you're going to sit here and wait around for those entry-level positions, you're going to be waiting forever. And then again, you're going to be part of that chorus that says, I can't find a job and no one wants to hire me. Meanwhile, how many positions did you apply for? Maybe 4 or 5? No, you need to be applying. That lady applied for, she got 60 something rejections and she still kept going. And 100 and something applications later, she found her first job. And y'all have to be like that too. And again, not a lick of experience. So that's the thing. And stop listening. Before I'm going to wrap this up, stop listening to people who are ignorant, who are not medical coders and don't know what we do. Okay? If it's an admin person, that admin person is not a medical coder. How can you speak on something that you have no idea about? And trust me, they're out there. Even nurses do it too. Oh yeah, I know all about coding. And meanwhile, they've never been a coder. They have no idea what we do, or they don't really understand what we do, but they think they know what we do. So talk to coders. Talk to medical coders who know. And you have access to these people. If you are with AAPC and you can go to the chapter meetings, meet with those people there. Ask them how they got their first job. Okay? But don't sit there and listen to people who are admin people who have, again, no idea what we do. Okay? Be careful who you listen to and do your research, but apply and make sure, again, that you're arming yourself with a really good resume. So that's it. I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.